Hi, I'm Sheridan. I'm the pharmacist today.
Hello.
And we're just going to look at a prescription that you got today. So what you got is lisinopril for 10 milligrams. And there are quite a few indications and uses for it, but I'm going to go ahead and assume that one of the main diagnoses for it is what is called hypertension. So that would be like your high blood pressure. So I don't know if you've ever checked your blood pressure before, but a normal blood pressure for like people our age is about 140/90. So that might be one of the reasons that you got just this prescription for yourself. So that's one of the indications. Another one would just be like your heart failing. So that's just like basically just kind of goes together with hypertension. And so I just wanted to talk to you about like how you're going to monitor it, some of the adverse events you might experience, and that kind of stuff. So one of the things that you could actually experience with this medication is hypotension. So that's just when you first take it, your blood pressure, when you go from like a sitting to a standing position, might decrease very significantly. So you just have to be cautious of that. Another one would be if you are going to become pregnant anytime soon, what they have on it is called a black box warning. So this basically means that your child in the second and third trimesters of your pregnancy could have some type of like just any type of malfunctions with them. So that this just is a not very good drug for that. Another thing that you're at risk for if you are taking this medication is called hyperkalemia, which means basically you're going to have higher levels of potassium. So if you're kind of at risk for some type of heart failure, so you just want to monitor even just like taking in large amounts of potassium, such as like just like an example would be maybe like eating a lot of bananas or something. So while you're on this medication, I would say to avoid stuff with a lot of potassium in it. And a big one with lisinopril and what this drug is called ACE inhibitor is a cough. So it'll be a very persistent and a dry cough. And more so, whoever you live with, as opposed to yourself, will notice it. So if it does become just bothersome, maybe talk to your physician about maybe changing your medication if you can't really. And another thing, it's called angioedema. So it'll be a very like large swelling, more in like your nose, throat, and like it's not just like it's not a mild one. It would be very severe. Like your lips would really have to be like swollen shut that you couldn't do anything. So that would be a huge one. So with this, I just want to tell you that all ACE inhibitors are generally dosed, which is this one, once a day. So you would just take it just like routinely, maybe in the morning when you wake up, leave it next to your bedside to take it. And then, what else did I want? And you do not also, for this drug, want to take potassium supplements like we talked about because it could increase your risk for heart failure. So, all right, so for this one, we might have to do, with regards to the hyperkalemia with the elevated potassium levels, we might have to do blood draws per month just to make sure that your numbers are within normal range. And I also would like you to notify your physician or myself if you start to experience that sore throat with the coughing, if you start to get like the very, very severe swelling of your lips, or if you start to have difficulty breathing. So another thing I just would like to talk with you about is that you need to check your blood pressure very frequently. We do have ones in the pharmacy if you've ever seen those before, and if you don't know how to do it, we could teach you how to do it. And so a normal, like I said for you, I just wanted to reiterate, is 140/90, so this is what this drug is going to help you get it down to. So what questions do you have? Any?
I think I'm good.
Okay, so could you kind of maybe just reiterate a few things about how you're going to take it and such?
Take it once a day.
Mm-hmm.
Don't take potassium supplements.
Right. Mm-hmm. And any type of food, like I said, maybe bananas, that kind of stuff that has a lot of potassium in it, so just kind of monitor that. So also with patients that are experiencing higher blood pressure, I always try and talk with them about adhering to a good diet plan, so like high fruits, high vegetables, very low like saturated fats and just fatty foods in general, so kind of avoid maybe like processed foods, fast foods, that kind of stuff, and engaging in physical activity throughout the week, maybe like most days of the week. Maybe are you engaged in physical activity? Mm-hmm. Okay, so yeah, stay with that, and just try and maintain a healthy body weight and limit your alcohol use and tobacco use throughout the week. So that's another thing I'd like to enforce. But yeah, do you have any other questions with it?
I think I'm good.
Okay, thank you.
So things that you did well, the eye contact, definitely. Speaking at a level that I could understand. I liked how you talked about like the blood pressure, like screening, that how like you could like teach me how to do it or whatever. Need to improve upon. Maybe speaking a little slower.
Okay.
I think you spoke at probably like 8th or 9th grade level, probably. And what medication did I take and why? Lisinopril for high blood pressure. And you didn't use any words that I didn't.